Hi there, I'm Rachel and this is my mom Amy. She is both a nurse and she had Lyme's disease a couple years ago. How many years ago was it?
4.
Okay, so 4 years ago. So, kill two birds in one stone. We can get her perspective as a healthcare provider and as a patient. So, my first question for you is going to be, how does Lyme's disease occur? Like, we know that it occurs from a tick bite, but how does that process happen?
Okay, so Lyme disease is transmitted via ticks, usually that have been picking up the disease from other mammals like deer. So a deer tick is a common tick that they will search for when they're looking at Lyme disease to see if you've been exposed to deer ticks. And Lyme disease is transmitted through the tick bite. It is a corkscrew-shaped bacterium, and it is left behind after the tick bites you.
Okay, so most of the time, like deer might carry it, or like dogs or other animals,
That's
like
correct.
in foresty areas, you
That's
would
correct.
say? Okay. So in terms of like getting diagnosed with Lyme's disease, how does that look? Like what, if you go in and you think you have Lyme's disease, what kind of tests will they run, and how accurate are the tests, would you say?
Well, the trick with Lyme disease in terms of getting diagnosed is that there is a window of time where your body will send out markers that are prolific, so like in a greater abundance. And if you miss that window, then the tests in general are not very good at picking up latent or later on, long-term Lyme disease. And so when you would go into a healthcare professional to see if you were carrying Lyme disease, you would usually go in because you're having trouble with any number of organs which may or may not tip them off that it could be Lyme disease. They will usually ask if you've had a
Bull-shaped
mark,
a bite?
yes, a bite.
Okay.
And a bullseye bite, and if you have not had that, which I did not have, then they will then start asking you other questions, particularly to do with joints and muscles. Although Lyme disease can also affect your brain and other organs as well as any part of your nervous system.
Okay, for you to get treated with Lyme's disease, do you have to have the positive blood test with the markers present?
Usually doctors do not want to treat you with long-term antibiotics, which is what Lyme disease requires that you get in order to be treated thoroughly for it. And long-term being at least a month. Usually nowadays they're saying 2 months. And so, yes, you would need to have those markers come back positive on the test.
Okay, so would you say that most people who have Lyme's disease aren't able to get treated until like later when the results show up more?
Well, there's a lot of discussion and research going on right now about latent Lyme disease or chronic Lyme disease that is considering the fact that a lot of people may not have been diagnosed correctly or diagnosed at all. And so some believe that other diseases like fibromyalgia and muscular sclerosis are actually some people with Lyme disease.
Oh, okay, interesting. Okay. When you had Lyme's disease, like what were your symptoms like? Like how did it affect like your day-to-day life as a mom, or like what did you think was going on?
I was not sure what was going on at the time. I knew that initially I had what they consider flu-like symptoms.
Mm-hmm.
This is all in hindsight. So originally I thought that I had caught a flu or a virus because I had a weekend and a couple of days where I was really in bed sick, which was unusual for me. But I was so lethargic and just feeling like I had been hit by a truck or something, really,
Mm-hmm.
really tired. And I had a little bit of a head cold. And so we're at 4 minutes.
You can finish yourself.
So after that, I got better, and I didn't really think much of it until about 4 to 5 weeks later, I started having some very odd symptoms for me, which was roaming joint pain. And it was extremely unusual for me to have any type of muscular or joint pain. And this was joint pain that would migrate from my elbow to my wrist to my hip within a matter of hour or so.
Mm-hmm.
And that to me was a very odd symptom. So I started researching a little bit, had heard of someone else in the area who had Lyme disease. This was when we were overseas. And sure enough, my symptoms matched up. I had to convince the doctor to run the test because he thought that since I was a new expat overseas, that I was just suffering from traveler syndrome. He said, "You're just depressed. You need a hobby." I said, no, really, I think just humor me, please just run the test. And he did, and he was very surprised. He called me back about 48 hours later and insisted that I come in right away and start on treatment. So.
Okay, awesome. Well, thank you very much.
Thank you.
Well, Victoria, it was really nice of you to invite me to your home.
You know what? You're always welcome, Melissa. I'm gonna sleep out under the beautiful stars. And you should too.
You know what, Victoria, I'd really love to, but I don't want to get the tick bite. That's why I'm wearing a hat. I got some bug spray, long sleeves, and pants. So I think I'm going to sleep in this tent here so I don't get bit by one.
Alrighty, good night.
Good night.
Oh, how'd you sleep?
I slept really great. How'd you sleep?
Oh, I slept fantastic.
I'm a little itchy right here, though.
Oh, that's just a kiss from a mosquito.
Hi, Alyssa.
Hi.
Hi, how are you doing?
I'm okay.
Good. Okay, before I begin, I'm going to perform hand hygiene. Done. But I'm not sure if you're Alyssa or not, so I'm going to check your identity. It is Alyssa. Okay, Alyssa, what brings you in today?
Well, I went camping like a couple of weeks ago, 2 weeks ago, with one of my friends, and I wore long sleeves and I wore bug spray and I wore like one of those hat things to cover my face because I'm really scared of ticks. Well, then I got this like really weird rash on me.
Okay, mind if I take a look?
And it's like
All
continuing to get bigger and bigger. And I've been experiencing like really bad like fatigue, and I've been sleeping for like 15 hours a day,
Okay.
and really weakness. I can't drive because I can't push the brakes.
Mm-hmm.
Fever and kind of like nausea and yeah.
Okay. Have you been experiencing any abnormal neural problems like numbness, tingling, anything like that? You don't have any problems with your face drooping?
No.
Okay, well, so tell you what, Alyssa, we're gonna run some lab tests, and I'll tell you what our findings are, okay?
Thank you.
What I'm gonna do is we're gonna draw some blood just to rule out a few diseases. I'm thinking Lyme disease, that's what we're gonna be checking for here when we're analyzing your blood, okay? It's Lyme's disease. Hi, Alyssa.
Hi.
Hey, how are you doing?
I'm okay.
Okay, so we got the test back. You did test positive for acute stage Lyme disease. So it's all right. This is what we're gonna do. We're gonna start you on antibiotics. You're gonna be taking them for a month, okay? So after you're done with that, we'll take another set of tests, and we're gonna see if this disease is still active in your system. As of now, during this first month, don't give blood. Be sure to take some probiotic supplements because you can get yeast infections while you're on antibiotics, all right?
Okay.
So we're going to get you started on that, okay?
Okay.
All right.
Sounds good. Thank you.
Hi, Victoria.
Hello, howdy.
Well, hi, how are you doing?
I'm doing better days. I've seen better days.
Okay. Hey, Victoria, what brings you into the clinic today?
You know, I've just been feeling kind of crummy. And I remember about a month ago, I was feeling all sorts of tiredness, and I had fever and chills. But I think that's because my tent had a hole in it.
Oh, okay. Okay.
So-
You've been outside at all?
Yeah, I have a tent, and that's where I sleep. Sometimes I sleep outside in the grass.
Okay. All right. That's fair. Any more symptoms you can tell me about?
Yeah, I got this weird thing on my back.
Okay, do you mind if I look at it?
No.
So, yeah, I see that. That's quite a bite there. That's a decent sized rash.
Oh, dang nabbits.
Yeah, have you had any other symptoms like joint pain, weakness, abnormal muscle movement?
Yeah, wait, my muscles sometimes they just go like this and this and this
Oh, okay, yeah.
and this.
All right.
I don't know.
Any cognitive problems?
Well, I always got those, so I don't think so.
Oh, all right. That's fair. Victoria, we're gonna run some blood tests on you and just kind of rule out some diseases, okay?
Sounds good.
All right, we'll be in touch. Victoria?
Hey there.
Hi, how are you doing?
I'm doing good.
Okay, so we got the test back. You are positive for late-stage Lyme disease.
But I don't need limes.
Okay, that's not what this disease is. Basically, what happened? Remember that rash?
Yeah.
So that's where a tick bit you. Deer tick, okay? So what happens, tick inserts a bacteria. It's kind of spiral shape. It's called Borrelia burgdorferi, but we call that Lyme disease. And what it does is it drills its way throughout your system, primarily your lymphatic system. And once it gets in your bloodstream, that's when you kind of see those symptoms like your muscle discoordination and stuff. Yeah, that. And so what we're going to do now is we're going to treat your symptoms, all right?
Okay.
Yeah?
Okay.
Sound like a good plan?
Yeah, I should probably move into a house.
That might be a good idea.
Does anyone need a roommate? But I got a better idea.
Lisa. And I'm not sure what's going on. Oh,
Cool.
Hi, guys.
Oh, I slept great. How did you sleep?
I slept great too.
All right.
Make sure my butt crack ain't showing.
Okay. Oh, okay. All right,
Hold on, it's showing.
I don't care.